Assalamu alaikum. I am Kandil and I am here to discuss about the history of capsaicin. Capsaicin is originated from a crude drug named capsicum annuum. There are also different names include jalapeno, sweet chilies, chili, basically capsaicin. The compound capsaicin was first isolated by Christian Buckle. After a few decades, it was named capsaicin by Harry Breckent. In 2009, European Union and FDA approved capsaicin, specifically 8% patches of capsaicin. It's licensed in the UK for osteoarthritis and you can get it on the prescription in the form of gels, creams and plasters. Its chemical structure include 8-methyl and vinyl 6 non-enamide. Its formula include C18 H27 NO3. This chemical compound is crystalline, off-white solid, lipophilic, colorless and odorless. Its melting point is 62 degrees Celsius. Its boiling point is 210 degrees Celsius. Here is a simple method for preparing capsaicin extract from chili pepper. For this, we require materials like dried chili peppers, ethanol, glass jar, cheesecloth, funnel, glass bottles. First of all, remove the stems and seeds from the dried chili pepper and chop them into small pieces. Place the chopped chili peppers into a glass jar and cover them with ethanol. Seal the jar with a lid and shake it gently to mix the content. Allow the jar to sit for at least a week in a cool, dark place to allow the capsaicin to extract the peppers. After a week, dispense mixture through a cheesecloth using a funnel to remove the solid particles. Transfer the capsaicin extract to a glass bottle with a dropper cap and store it in a cool and dark places.
Assalamu alaikum, my name is Mohammad Abdullah. I am here to talk about the mode of action of capsaicin. There are two concepts, an old concept and a novel concept of capsaicin TRPV1 activation. In the old concept, TRPV1 is activated by transport of sodium ions inside the membrane causing action potential stimulation, but in the novel concept, activation of TRP1 causes heat generation and desensitization of nervous system, giving pain relieving effect. Let's talk about the pharmacokinetics of capsaicin. Orally, capsaicin may be observed by non-active process from stomach and whole intestine by extent of absorption of 50 to 90%, undergo minor metabolism and metabolize into different metabolites like hydrated version of capsaicin and vanillin. Systemically, it is not much present in the blood as it is comparatively it is present in the brain and in the liver. In brain it is present 5-fold higher than in blood. In liver it is present 3-fold higher than in blood. Topically through skin it can be absorbed readily, and the values of the mean peak plasma concentration of capsaicin is 1.86 mg per ml. Maximum value observed was 17.8 milligram per ml. Now talk about the metabolism and excretion of capsaicin. Is metabolized, some of it is excreted in the form of capsaicin. It is metabolized into different metabolites. The most famous one is vanillin, which also is an antioxidant. These metabolites conjugate with glucuronic acid or sulfate and then excreted by kidney, or it can get stored in bile in pancreas, got excreted from GI tract with feces.
There are two types of drug, FDA labeled drug and FDA non-labeled drug. The FDA label indication for capsaicin are arthritis and musculoskeletal pain. And FDA non-label indications are neuropathy post-operative complications, post-therapeutic neuralgia, post-operative nausea, vomiting, and psoriasis. Further, capsaicin has a wide range of uses. Pain relief. Capsaicin is often used in topical creams and ointments to relieve pain. It works by blocking the transmission of the pain signal to the brain. So, capsaicin can particularly affect further conditions such as arthritis, neuropathy, and muscular soreness. Second use is weight loss. Capsaicin has been shown to increase metabolism and promote fat burning. The third use of this capsaicin is skin care. Capsaicin has antioxidant properties and can help reduce inflammation and redness in the skin. It is sometimes used in skincare products to help treat acne and other skin conditions. Now we all know the uses of the capsaicin in cooking. Capsaicin is a popular ingredient in spicy food and sauces. The special use of capsaicin is treatment of prostate cancer. It has shown promising potential in the treatment of prostate cancer, while its exact mechanism of action is still being studied. There are several ways in which capsaicin may exert its anti-cancer effects. Let's see. First, apoptosis induction. Capsaicin has been found to induce apoptosis, which is programmed cell death of cancer cells. It activates various molecular pathways that trigger apoptosis, leading to the elimination of prostate cancer cells. Second, anti-proliferation effect. The capsaicin has been shown to inhibit the proliferation or uncontrolled growth of prostate cancer cells. It can disrupt cell signaling pathways involved in the cell division, leading to a reduction in cancer cell growth. Third, anti-angiogenic properties. Angiogenesis is the process by which tumors develop a network of blood vessels to support their growth. Capsaicin has demonstrated the anti-angiogenic effect by inhibiting the promotion of new blood vessels in prostate tumors, thereby depriving them of nutritive and oxygen. Androgens, such as testosterone, play a crucial role in the development and progression of prostate cancer. Capsaicin has been found to modulate androgen receptor expression and activity, leading to the suppression of androgen-dependent prostate cancer cells.
My name is Mohammad Ahmed and I am here to discuss about other doses from the unconventional ones like home remedies and toxicity of capsaicin. Home remedy. The most known home remedy of capsaicin is used for sore throat. In this remedy, we use 1/4 teaspoon of capsaicin powder with 1 cup of warm water. Stir well, then gargle every hour is needed for sore throat. Tincture. There are also tincture made with 1 ounce by weight pepper flakes with 5 ounce by weight grain alcohol. Salve. Salve is made with mixing pepper flakes, olive oil, beeswax pellets, and vitamins. Capsaicin mixed with rubbing oil can be used to make capsaicin liniment. Did you know that capsaicin can be used to make special kind of tea? Toxicity. The acute toxicity of capsaicin can be determined in several animal species like rats and hamster. However, the LD50 value of capsaicin administered here is of Swiss albino mice. These values are of oral 190 mg per weight, intramuscular 7.80 mg per weight, intravenous 7.65 mg per weight, subcutaneous 9 mg per weight, and intraperitoneal 7.65 mg per weight. The reason of different LD value is due to different rate of absorption and environment of absorption. Let's hear it from Abdullah.
The dose of capsaicin for topical use is 0.5%. It is mostly used in ointments and creams for musculoskeletal pain, arthritis pain, osteoarthritis. For weight loss, the concentration is 50 to 40 gram per day. The course of therapy for topical use is not defined. You use as much as you can at the site of inflammation or at the site of pain. For the risk and precautions of misuse of capsaicin, if you accidentally place high amount of capsaicin on your skin, you cannot remove it with vinegar or other compounds, but you can remove it with detergents and place ice on the injury, on the burned area. The primary treatment is healing the wound, cleansing the wound, and cleansing and putting ice on it. In market, capsaicin is been highly used and highly appreciated drug. Many companies are looking forward to marketing it well and making new uses for it. Market is very appreciative of this drug and it has a larger scope. The brand that is existing in Pakistan is Capsidol. Well, there are many brands in the form of ointments. There are very few, even negligible amount of brands in oral dosage form. The brands we have searched for are Capsaicin P, Zostrix, Capsaicin HP, No Pain HP, Ridapain, Pain X, and many more.